Okay, so then let's recap. You were here a week ago. You began chiropractic treatment, and that seemed to help. And also, finding was that the shoulder was dislocated and it's slipping, but not fractured, which is a good thing. And you were going to start at twice a week. And also, finding is that the sacrum was not aligned. Left arm, left hand is comparatively weaker than the right. The acupuncture, you were coming in once a week, and the previous treatment, so that was 2 weeks ago, that helped for several days for both the left arm and the back. The chills that you were experiencing since the fall has been the same. Okay, and so that's what I noted. And then, well, we see what the acupuncture is doing, and I added more points last time to see how well you were doing with that, how much further hopefully you have an improvement comparatively. And also with that improvement, it helps to know your diagnosis, your body type diagnosis. Therefore, what you can do for yourself can may be additionally helpful. Okay, so that's the part where I could recommend stuff for you.
Okay.
All right, so with that recap, how did you do with the last treatment?
I feel like I did much better.
Last treatment was better than the previous treatment.
That is correct.
Okay.
Yes, I experienced less chills.
Mm.
However, I'm still experiencing a great deal of numbness on my left arm. My strength is still the same. I actually had an appointment with Kaiser on Tuesday, and then another appointment on Wednesday with a chiropractor, and they both tested my strength with this equipment that I needed to press on.
Yeah.
My right hand actually tested the same for both, 50, and my left hand was 20.
Oh wow.
For both.
Okay.
So I feel like my left arm is still not as strong enough as my right. PT is working on helping strengthen, but I think there's something like there's an underlying issue here that we don't know because it's like the most weirdest sensation that the numbness comes from the shoulder and then it goes down here to the palm of my hand, and I feel like tingling sensations on my fingertips. They also ran a test where they, for both left and right, they would kind of like, I don't know, scratch my palm, and I don't feel the same. The same sensation is not the same. Okay. So with that being said, Kaiser doctor recommended an X-ray, which I had completed, and the results are still not in. He also ordered an MRI.
Yep. Okay.
And that's pending.
Okay. All right. So then, a few responses here. There are findings, objective findings, and there's subjective experience. So let's talk about the subjective experience. The last treatment was better than the previous treatment. It sounds like some things are still better after 1 week, which is the experience of chills, right? As with the weakness, numbness, ache, pain in the arm, that was better for several days, but last couple of days same as a week ago? Or
yes.
Okay, all right, it's still the same. All right, and then yeah, that's why I was hoping that getting acupuncture twice a week might be better, so that we could like add the benefit to the benefit. Although, like some people, even last night, the last patient, he was doing better, and he's coming in once a week. That's all, the only time he could come in, and every week is better than the previous week. So people have different rate of improvement. So that's one reply, and the other reply is, all right, if the last treatment was helpful, then I think you're the blue body type, which is cool, which is warm and damp. Did we do the food exercise?
No.
Okay, let's do the food exercise. It'll be short, hopefully.
Okay.
Okay. The cool versus warm body type. Body type is your genetic profile. Why I said it that way is because everything within you is directly and indirectly related. And so then we could approach two ways. One, indirect, but that can be direct. And the other is just direct, which is local problem focus. Because that's what you're approved for and that's what you're here for. Okay, totally makes sense. But the treatment of natural medicine is taking you as a whole so that your automation is empowered to help itself. Even for low back pain, acupuncture hand in the leg and it helps the body to help itself, and that's why they get better. And so then, okay, what about mint? Is that cooling or warming?
Cooling.
Yeah. Celery?
Cooling.
Yes. Cucumber?
Cooling.
Yes. Aloe vera juice?
Cooling.
Yes. Cinnamon?
Warm.
Yes. Ginger?
Warm.
Turmeric?
Warm.
Okay, so if you're a warm type, what do you need? Cooling foods or warming foods?
If I'm what? I'm sorry?
If you're a warm type, do you need cooling foods or warming foods?
Would it be cooling?
Yes.
The opposite.
Yeah, the opposite. Okay, so if you're a cool type, then you would be warming.
Okay.
All those ingredients are known for digestive tract, inflammation of the gut. But you want to be selective for the person. Like medication, it works well for some people, other people not as well, other people they have to change. So people don't have the same physiology. Therefore, you can't do problem focused all the time. Yeah, some things, yeah, problem focused. Some things just apply to everybody. But some things you have to distinguish.
Correct.
Okay. Alright, so then you're a warm type. Alright, nobody's perfect. Within normal range, some people are on the warmer side, some people on the cooler side. But if they add warm to warm, then that could go out of range of normal. Like when you get a blood test, you're looking for a range of normal. You're out of normal, then you're out of balance.
Yes.
Right? Then your body's not functioning too well.
Yes.
Yeah, so that's the idea. Do the stuff, put the right molecules in your body so that your body has that proper automation towards health and well-being for self-healing, in other words. So it's not elimination diet. It doesn't mean that you cannot have cinnamon, ginger, and turmeric. It means that if you're having them because they're anti-inflammatory, then they're in your supplements, perhaps not for your body type. Okay? Because they may reduce at the superficial level, but at the fundamental level, it's creating chaos. So it's causing more difficulty within for you to come back to normalcy.
Okay.
Okay, you see that?
Yes.
Okay,
Yes.
the logic.
Yes.
I know you can't verify this with science, but by experience and through generations and through history of time, you just can't break that. That's how it is.
Okay.
All right. Then, yeah. So then you want to reduce what's bad because you put in good. That's not going to cancel out the bad. Okay. So then again, you don't eliminate. It's in the food, no problem. But you don't want to have it like medicine, thinking it's good for you. Then that'll be too much and too long. And like, okay, so you reduce what's bad. What about, let's go additional ingredients here. Chicken, is that cooling or warming?
Warming?
Yeah. So if you think chicken is good, you have it every day, sorry.
Oh, wow.
Okay, you see how that could go like that, right?
Yeah.
Okay. What about egg? Is that cooling or warming?
Warming?
Cooling. Egg is
Oh.
actually opposite. So you're okay with egg.
Okay.
All right. Okay. And then you could get a list of food so that you could reduce the negative foods, and then you could incorporate the good foods for you. It's subtle, but it raises your health and well-being. Health is less problem, better function. Like you're here for your health, right?
Yes.
Well-being is a quality of you on a day-to-day basis. Like you feel uplifted, you feel more clear, and you have stamina throughout the day. And you feel integrated because many things are working better. So as a whole, you feel like you're moving as one.
Correct.
Yeah. So that would be well-being category. And yes, the way I see it is, okay, you're set up, so therefore when you have an accident, it's hard for you to come back. So let's just remove that setup.
Yeah.
Or reduce that setup. Okay, and that's within your power, that's within your control. Okay, so yeah, so that's why knowing your body type helps with knowing what to do
Like the
to
treatment
to
plan?
put in your mouth, right?
Okay.
And so reduction of bad and also addition of good. Addition of what good? Mentioned about aloe vera, cucumber, and celery. You could have 1 cup of aloe vera juice. You could get it at Trader Joe as an example, 1 gallon of it.
Okay.
2 celery sticks, 1 cucumber, and frozen mixed berries.
Mhm.
Half a cup of frozen mixed berries, because not all berries, but definitely strawberry, raspberry, blackberry, they're cooling.
Okay.
Okay. So some people are allergic to strawberry.
Yeah.
They're the cool types. So if it's extreme, it becomes bad reaction, right? But
Yeah.
for the opposite, it's good for them. People, human beings, we think they're the same. We study as if they're the same because it's just a simple approach. But actuality is that people are opposite in different layers. Okay, like nuts. Some people good with nuts. Some people bad with nuts.
Mhm.
Right? Okay.
Yeah.
Yeah, that's an extreme example. And so you do that every morning for 2 weeks, then that'll help reduce inflammation and promote healing. And if you do that every day beyond 2 weeks, your blood sugar will go down too much because it's also used to treat diabetes for the hot types.
Yeah.
You've heard that cinnamon reduces blood sugar, right?
No.
It's been known. Okay, look it up. Yeah,
Wow.
it's been known. But that would be good for warm types, right?
Yeah.
Hot types shouldn't have cinnamon to reduce their blood sugar, because not one thing does one thing. It may reduce blood sugar. Again, that will cause chaos within and
Yeah.
compromise your physiology. And then after 2 weeks of taking it, you see that it's helpful for you. Your health seems to be a little better. Your well-being is a little up. It could be subtle. It's not like dramatically. Oh yeah, I could tell. Like I'm taking medication, I could tell the difference.
Mhm.
But you're setting yourself at the right direction.
Yeah.
And then on an indefinite basis, you have that 3 days a week.
Yeah.
Because nobody's going to be staying perfect or staying at that optimal level. We always have to support the
Yeah.
body to stay at the optimal level. All right. Yeah. So then there's the idea and there's the application.
Should I be taking supplements?
Of what?
I don't know. Like, since because of my body type, I mean, I don't know what's good for me, to be honest
Oh,
with
okay.
you.
So then you'll get a list, right? It's in the book. It's $13. Are you okay with that? Okay. Yeah, then I'll show you. And then since there's a longer list, we don't know everything, but how about this? Those are the common known ones.
Okay.
Okay. And therefore, when you adjust, you get to adjust a lot.
Okay.
And if the ingredients are not in there, likely they're good for most people. So this is not restriction. It's reduction of what's not good and adjustment towards what's good.
Yeah.
Okay.
I think what's like not confusing, but it's frustrating. Many people don't know what's good for them, right? In regards to like what's healthy, what's not healthy, what makes you swollen, what doesn't make you swollen.
Yeah, that's why there's fad.
Like I don't even know what's good.
Fad comes and goes, right? And then there's always people go, yeah, but not me, right? How come it's good for others but not me? And then they don't have much voice on that, right?
Yeah.
Well, if you're allergic to certain foods, okay, avoid them.
Yeah.
That's all you get, really.
Yes.
Right?
Exactly.
Yeah.
Exactly.
And well, but what about allergy tests, skin prick test, and blood allergy test, IgG tests, things like that? Those are not. They're definitely useful, but there's areas that they don't measure. Okay, so then incorporating both objective and subjective like this helps out quite a bit.
Yeah.
All right, and so far, the allergy test is there to help out, but it's really not so advanced enough that people could have a program they could use.
Understood.
Okay.
Okay.
All right, let's get started.
Very good.
Yeah, head there, legs up there.
Okay.
Mm-hmm.